Now to matters health, where as the doctor strike continues at public facilities, stranded patients may soon have nowhere to turn to. The Kenya Private Hospitals Association has announced they will soon stop offering services to NHIF card holders over non-payment of pending claims. The association has issued a 7-day notice to NHIF to release funds owed to its member hospitals, while the Rural Private Hospital Association of Kenya issued a 14-day notice which lapses on Sunday, citing non-payment by the National Insurer. Health Cabinet Secretary Nakhumicha, speaking before the National Assembly Committee, blamed the delayed payment of NHIF monies on the late remittance of NHIF deductions to formal sector employers. Citing reports.
The effect on the delivery of healthcare occasioned by the doctor's strike is said to become even worse after Private Hospitals Association in the country announced that they will stop offering services to NHIF beneficiaries, citing non-payment by the NHIF. The Kenya Association of Private Hospitals has issued a 7-day notice to NHIF to release funds owed to member hospitals or have NHIF members denied health services.
This challenge has been the amount of payments that have been coming into the facilities. I think this has lasted over 6 months, where the payments to the hospitals have been coming in very slowly and very little amounts. Our facilities are struggling to make ends meet.
The effect of the delayed payments of NHIF funds to private hospitals.
Madaktari wanalia, NHIF wanalia, wanasema wewe ukienda na kadi ya NHIF huwezi tibiwa ati hawana pesa, madeni mko na madeni zao mingi. Kumaanisha hizo pesa kuna midomo zenye zinameza hizo pesa, na sisi hatutaendelea. Ni heri mtoe hiyo NHIF isukue, tuwe tu kama kitambo, unaenda tu hospitali, unapokonjeka unajilipia pesa yako unatoka, kuliko mtukate mtuumize bure.
The notice is similar to another one issued by Rural Private Hospitals Association of Kenya, and which lapses on Sunday, demanding the payment of shillings owed to its members. The association says NHIF has failed to remit payments for services offered to Linda Mama beneficiaries in rural areas. The two associations saying debt has made it difficult for health facilities to meet overhead costs, leading to the laying off of staff and closure of some facilities.
To be able to pay your debt within 90 days. So for sure, NHIF has exceeded the credit limit within which we've agreed upon. So essentially, going forward, when the deadline reaches, if we have not gotten into an agreement with NHIF and payment has not come out, our members will not be able to serve NHIF beneficiaries, and so those patients will be able to only access services if they are paying cash.
The delay seems likely to continue for the foreseeable future, as Health Cabinet Secretary Nakhumicha says the ministry is cash-strapped and blames the shortage of funds on delayed remittances. She also denied allegations that NHIF funds had been diverted to other institutions.
Unfortunately, from where I sit, I cannot give timelines unless Treasury has given a commitment, which, as at this morning, they have asked me to wait for next week, based on what we have agreed on, so that then they can disburse in some form of some amount. Actually, the agreement this morning is that at least we get a minimum of 2 billion next week to be able to meet our commitments. But however, you can see the need is huge. The resources are not available. So we are in a catch-22 situation.
Reporting for Tandao News Outlook at 1, I'm Joy C30.